Hi, my name is Adrian. I'm going to be performing the GI, Neuro, and Muscular Skeletal Assessment. Now, the first thing I'm going to do is introduce myself, hand hygiene, and also explain to the patient what I'm going to be doing. Hello, good morning. My name is Adrian. I'm going to be your nurse for today. I'm going to be performing some assessments on you. Is that okay?
Yes.
Can I please have your name and date of birth?
Annie Camaro, November 17, 1965.
What is today's date?
October 14, 2022.
Okay, and also what city are you
In Orange.
in? Okay, I just had to see for my patient's alertness. Overall, like her general appearance, it just matched her ethnicity, which is of African American descent, and she seems alert and oriented times free. So the first thing I'm going to be doing today is inspecting her abdomen. So like, can you please lay down on the table, or like in this case, couch. So for this case, it's going to be inspection, auscultation, percussion, and palpation. So I'm going to have the patient lie in their back. Due to the cultural differences, because like she is Islamic, I'll have to ask her like, would it be okay for me to like lift up her shirt? And if the patient says no, then like I do have to respect their whole decision. But if she did allow me to like look at her abdomen, like I'll have to check for like any like scars, any wounds, hernia, or masses, or like if she has like a peg tube, and also like if she have like an ostomy. So like if she does have an ostomy, like I have to check for the color of the stoma. If it's like a pink rosy color, or like it's like a beefy red, that's good. But like if it's like a dark blue, like darkish color, then that's bad. And also I would check for like the smell of the stool. So like have you have any like stomach issues or like any stomach pains?
No.
When was the last time you had a bowel movement?
9 o'clock this morning.
Okay. How are you like urinating? Like, is it painful? Is it normal?
It's normal.
Okay. If she was a man, then like I'll have to ask like how's the stream to like I guess check for like like any prostate issues, and also like if she was a female, which like she is, like I'll have to ask her like when was her last menstrual cycle, and like for her it's been some time since then. And even like before like I start to like also take her stomach, like I will have to ask them to like empty out their bladder. So from there, like if I was able to look at her abdomen, like I'll have to check for the abdominal contour, which is turbulent. So like that all depends on the patient's weight. And also like I will be able to like check for any pulsations or like any hernias or wounds, any cuts. I'll also be able to stay at the belly button. So from there, like the second part is the auscultate, which I'll have my handy dandy some stethoscope. So I'm going to be checking for bowel sounds at like a clockwise motion, checking off for the quadrants. I'm going to be starting with the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Now, normally I will be checking for 5 to 30 sounds within each quadrant with the diaphragm of my stethoscope, but if I'm not able to hear anything within like one of the quadrants, like I'll have to listen for a full 5 minutes. And so far, like the bowel sounds are normal. So the next thing I'm going to be checking for is the aortic artery, which is below the xiphoid process, but like a little bit above her belly button. And like I'm going to be using the bell of my stethoscope to be here for that. So like I'm going to be trying to go for like a bullet, like which is like a blowing, or like a whooshing sound. know who it hurt. Okay, that's good. So from there, I'm going to be trying to hear for the arteries, like, which is a little bit away from the aortic artery, but like not too far apart. So that would be the left artery, which is right here. So far, who noted the left artery, which would be here. Okay. So the next artery I'm going to be checking for is the iliac artery, which is a little bit below the patient's belly button. So this is the right iliac artery. This is the left iliac artery, which is right here. And for the femoral artery, like, it's way below the belly button, like around this area, but I'm not going to check on this patient because I'm trying to inspect their privacy space. So the next thing I'm going to be doing is a light palpation, which I'm still going to palpate the patient's abdomen clockwise, and I'm going to be going in about 2 centimeters like into the patient's abdomen. That's so. I'm checking for like like masses, anything like that of the sort. So like the liver like would most likely be in the like upper quadrant, which is here. The spleen will most likely be within the left upper quadrant, but I should be able to palpate it because like if I am able to palpate it, then like I don't want to cause any sort of hemorrhage or at least like emergency situation. So like the last step, but not the least, is I am going to be doing a deep palpation. It should be 4 to 5 centimeters like within the patient's abdomen, but like if I don't have the strength, like I have to use 2 hands to do that. The limb will be here. Can it be right here on the flank side? Okay, I don't feel any hernia, I don't feel any hard masses, anything like that. Okay. And the aortic, right there. Okay, so that'll be the end of my GI assessment. So the next thing I'm going to be assessing for is her upper extremities. So like I'll let my patient to please set up, please. Okay. So I'm going to be inspecting so far the clavicle and also the shoulders right here. So from there, I'm going to be like palpating her joints to make sure everything's okay. Like I'm just going to be checking for like range of motion. Is this painful like as I'm like doing this to you, ma'am?
No.
Abduction. Okay. Here. So for neck, shoulder, and elbow, like, can you move your head like up and down like this? Up, down, side, 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 side. Okay, try to move your shoulders up. Okay, good job. Elbow. Okay, elbow 2. So I'm going to be checking the reflexes of the biceps. So I'm going to get my handy dandy reflex hammer, as such. So for the bicep, I'll do like this, okay? It should be here. So your arm should move as, there you go, you got it. Okay, so the vacuole, that's okay. That should be here. Sorry. And you're jumping. The reflexes are good so far. And for the triceps, it should be right here. It should be this tendon right here. So it might be a bit tricky. Okay, that's good. So I'm going to be checking for like her radial pulses, which is right here. Radial pulse right here. And your brachial pulse. It's right here. Yeah, this one's a little bit hard to find, but still, there you go. So I'm gonna inspect her hands. Like, can you put up your hands like this? I'm checking to make sure like they ain't like joints out of place. So far, is this painful as I'm doing this, man?
No.
Okay, that's good. Let's check here. Okay, so like try to like squeeze my hand as tight as you can. Okay, good. Okay, checking the wrist. Checking the wrist. Okay. So the next thing is I'm going to do your hips. Okay. Can you stand up for me? Okay. Okay, so like palpating the hips, make sure everything's okay. Can you try to like walk in place for me? Okay, so far your hips is fine. There's nothing in there. So you can sit down. Thank you. So the next part is to check the lower extremities. Okay, I'm gonna ask my patient to like keep his like lay back on the table or the couch, please. Okay, so I'm gonna be inspecting her lower legs and knees to make sure like the circulation is fine. If she didn't have any hair here, like unless like she said, unless she was like shaving, then that means like there's some type of muscular skeletal issue going on. Okay, so I'm gonna inspect and palpate the extremities. Does this hurt as I'm touching you?
No.
Okay. Checking her pulses on the ankle. Okay, can you do like this in the chair? Okay, for both legs. Okay, that's good. So I already palpate the pulses. The next one I'm gonna do is okay, tendon. Okay. Let's see. Okay. I'm gonna check for her patellar reflex because it's hard for her to lay on her stomach. I'm gonna end up doing it like sideways. So patella. It's like this. So like basically the patella is like back here. So what I'm gonna do is I'm just gonna. And her foot is moving. Okay. Use the back of my foot. Okay. I'm gonna be checking for her. Let's see. Do you feel any pains on doing this now?
No.
Okay, that's good. So I'm gonna be checking her plantar reflex with the back of my hammer to see can she like feel anything. Okay. Please. Okay. Okay. Okay, I did that too. Okay. So I'm gonna ask my patient to please stand up for me. I'm checking her spine to like make sure like the posture is fine. I'm gonna be checking like the vertebra as well. Everything's okay. So I'm gonna ask the patient to like follow my movements, like go like this, go like that, side, side. Okay. I'm gonna ask my like patient, can she please sit back down? The next thing I'm gonna do is I'm gonna be checking the patient's cranial nerves. So the first cranial nerve is the olfactory, like which is smell. So I'm gonna ask my patient to please close her eyes. So as I do this, I want to put something pleasant and not offensive to the patient's nose, like before I make the gag reflex. So I'm gonna ask my patient to please close her eyes. Okay, like what do you smell?
Flower.
Okay, that's good because like this is like a flower body spray. It's very good. So for cranial nerve number 2, which is the optic nerve, what I'm gonna do is I'm gonna stand in front of the patient like this. I'll have the patient close one of their eyes. I will close the opposite eye. Now I'm gonna ask the patient like, What can they see like as I'm like holding my hands up?
1, 2,
Okay, and we're gonna do the opposite leg with the other hand.
3, 4.
Very good. I will check for the Snelling test as well to check the patient's visual acuity. However, like my patient, like she doesn't wear glasses for like long distance, and unfortunately, like the glasses have to be like replaced, so we're gonna have to skip that portion of the test. So, like the next nerves I'm gonna check is for 3, 4, and 6, which is for extraocular movement. So I'm sitting for my patient, and I would do the 6 ray, and I would check for the 6 cardinal rays of gaze in order to see like is she gonna perform any extraocular movement. So, ma'am, I would like for you to follow my pen line with your eyes and don't move your hand, okay? 1, 2, 3, 4, 5, 6. Now, the next thing I'm going to check to see does her pupils like constrict due to the pen light. Because like usually like her pupils is between 3 millimeters, but then like for some people, like most of the time it should go to 1. Okay, it is constricting. This is the same. Good. So like her eyes does react to light. Yes. Then from there, I'm gonna lastly check for accommodation. So I'm actually to follow the pen light and don't move your hand. Very good. So she does pass the test for Cranial. Means eyes equally round, react to light, and also accommodate it. So the next cranial nerve is the trigeminal nerve. So I'm gonna have my patient, can you please like bite down for me as I check the masseter muscle, yeah? And so far, I don't hear like any grinding or like clicking, and also I will check for the temporal muscle as well right here, which is wrong. Can you please try to like open your mouth for me as like I put like resistance? Very good. So the next cranial nerve I'm going to be checking for is cranial nerve number 7. So I'm going to have my patient please close your eyes very tightly and open, smile, be mad, and puff up your cheeks. Very good. Good. So the next cranial nerve I'm going to be checking for is cranial nerve number 8, which has to do with hearing. So the next thing I'm going to do is I'm going to perform like the whisper test. Okay. So I'm going to be covering like on your ears, and I'm going to be like whispering some things to you. So try to repeat like what I'm saying to you as I whisper to you.
1, 2.
Okay. And I'm going to do the same thing to the other ear.
4, 5.
The next cranial nerves I'm going to check for is 9 and 10. Which I need my handy dandy gloves for this, and my tongue depressor. So after I perform my hand hygiene and put on my gloves, I'm basically checking for the glossoesophageal and also the vagus nerve at the same time. So after I put on my gloves and have my tongue depressor, I'm gonna ask my patient, like, can you please open your mouth for me? So like I'm trying to inspect the side of the mouth. I'll check the side of the tongue and the tongue strength, and most of all, I will check for the uvula. So for me to check for the gag reflex, I just have to lightly push it in, but like I'm not gonna like jab it because I'm not trying to actually like have a patient gag. There you go. Sorry. Sorry. So for cranial nerve number 11, like which is the accessory nerve, I'm gonna have the patient move the head side to side, up and down, and have them try to shrug their shoulders against resistance. Try to move your shoulders. There you go. And the last nerve And not the least is cranial nerve number 12, which is the hypoglossal nerve. So like I'm gonna have my patients stick out their tongue, move side to side. And now, my friends, and the neurological assessment for my patient. So like while I have my patients sitting down, I will have them do the range of motion, like can you do like this, like I just said, now for me? Perfect. So the heel to shin test is okay. Like I need my patient to take off the sandals. Okay, so like can you do like this? Okay, so have it go down like that. And try to do the same thing for the other foot like this. Okay. Alright. So the next thing I'm going to do with my patient is I'm going to check for the extracerebral sensation, which I'm trying to see like can the patient feel between like a soft touch and also for pain. So I'll have my patient close their eyes, and I need my patient to tell me like, is this like soft or like a soft touch?
Soft touch.
Okay. Soft or painful?
So.
Okay. Soft, painful?
So.
Okay. Which usually for the soft test, like one like use like a cotton swab, and for the pain test, like use like a pin, but then like don't use the same pin for everybody. Like they have to use like a hypodermic clean pin, and please don't ever use a needle for this test on anybody. So my patient, close their eyes again, and let them know like if it's like soft or painful. Is it sharp or painful?
It's
Sharp or soft? Sharp or soft. Okay. Good. So, okay, let's see. So the next part, let's see. Okay, I'm on my patient, close their eyes. Now I need to see like when your feet, please. Okay. Okay, please close your eyes. Okay, this is up. This is down. Up, down. Okay. This is up or down?
Up.
This one?
Down.
Very good. Up or down?
Up.
Okay.
Down.
Okay. I'll do the same thing for the other foot as well, but I'm just, I'm just doing an assessment. Okay. And I'll also check for the vibration as well to see can they feel the vibration like in their like lower extremities. So I have a handy dandy tuning fork. Are you able to feel the vibration? Okay, that's good. So for the standard trophy, okay. I'm gonna have my patient close their eyes. Tell me like what are you feeling in your hand? What is this?
Palm.
That's good. Okay. What is this?
Pen.
Very good. Okay. I'm actually like drawing my patient's hands to see like what do they feel. Okay, so I need you to close your eyes. Okay, so like what do you feel?
Like splash.
No, like is it like a 1 or 2 or 3 or
2.
okay. Let me try this. What's this?
8.
This is a 8. Okay. Let me try the other hand. Do you feel anything like a letter or a number? Okay, so what's the letter?
C.
Okay. So, okay, I'm gonna have my patient close their eyes, and I'm going to touch you in 2 places. So, like, you just let me know, like, where you feel the touch. Do you feel me touching you?
Yes.
Where do you feel me touching you? Your hands, your arms.
Uh-huh.
Just say what I'm feeling to touch. And your arms, your hands. Come on.
Hands.
Okay. Alright, so I'm gonna have my patient stand up. I'm gonna have them walk for me just like a little bit like walk like a little like normal line. So normally as a patient like walks like this heel, toe, I'm gonna have my patient come back. Heel, toe, come back. I'm not gonna ask my patient to like walk on their heels because like she did have a brain surgery a couple years back, so it might affect her. Okay, so the next thing I'm gonna do is check for the Romberg sign. So I'm gonna have my patient stand together, have the hands out like this. Okay, and close your eyes, but like the nurse have to make sure like they're there like just in case like the patient like loses the balance. So like, can you please close your eyes? Good. That means like her Romberg sign is like negative because like as soon as the patient like close their eyes and then like have the hands out straight, you tend to see some like drifting. So I'm gonna lastly check for the protonated drift. So I'm gonna have my patient stand close together and have like the hands up in the air like this. 1, 2. I'll have them count to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. So that means like she doesn't have the pronated drift because like usually like patients who have this like their hands will be drifting like as their eyes are closing, counting from 1 to 10. So like this completes the end of my GI, neuro, and musculoskeletal assessment. Thank you. Have a good day.
Bye-bye.